Hey guys, what's up? It's me, Ira from BSN 13D, Group 15, your student nurse on duty. So for today's video, I will be doing another return demonstration. But this time, it's gonna be a wound care. So please keep on watching. First is to identify the identity of your patient using at least two identifiers. It could be first the patient's name and second the patient's birth date. So it is done to ensure that you are doing the right procedure to the right patient.
Good morning, ma'am. Ma'am, pwede mo na si mohang pangalan ng birth date? Ano po ha?
Samantha Yumi Archong ug akong birthday July 11, 2009.
Salamat, ma'am.
Number 2 is to review the doctor's order for the irrigation. Also review what type of solution needed for the irrigation. It is done to ensure that you are doing the right procedure to the right patient. Also, it is another way to review the doctor's order to avoid mistakes during the irrigation or during any procedure for patient safety.
So, here's the doctor's order. To do wound care using a normal saline solution.
Number 3 is to assess patient's level of comfort, also assess for patient's pain tolerance. You can administer analgesics 30 to 45 minutes prior to the actual wound care. So ensure that the analgesic was ordered by the physician. So the analgesics works by alleviating the pain that can be felt by the patient during the actual wound care because the wound care can be quite painful depending on the pain tolerance of the patient.
Ma'am, kamusta imong samad, ma'am? Wala ba siya gangol-ngol or kanang gangot-ngot? Makabati ba kagkasakit sa imong samad?
Wala naman po, ma'am.
Maayo. So, kani ma'am, na ako'y dalang nga tambal, ma'am. I-order ni siya ni Doc. Ang tawag ani kay analgesic. Kaning analgesic or kaning tambal na akong dala, ako ani siya ang ihatag si Muha 30 minutos or 30 minutes bago ta mag-ilis ani imuhang dressing or kaning tabos mo samad. Kani ang purpose ani nga tambal kay unya ini mag-ilis ta og kaning dressing or tabos mo samad medyo sakit man gud jud na siya, ma'am. So kaning tambal kay para medyo dili sakit unya pag-ilis nato sa imong dressing.
Salamat kay ma'am.
Number 4 is to review patient's medical record on the symptoms of the open wound. This gives you, as a healthcare provider, an idea on what to assess to the open wound prior or during the wound care.
So now, reviewing patient's record of open wound. So, patient's pain scale is 6 out of 10. Interpreted as mild, then knowing pain.
Number 5 is to assess patients' allergies to food, allergies to medicines, and most especially allergies to the equipment that will be used during the procedure or during the wound care. It allows you, as healthcare provider, not to contribute any discomfort or any harm to the patient during the delivery of care. And also, if allergies are noted, report it directly to the physician in order to find an alternative for the allergies of the patient.
Ma'am, napa kay mga allergy sa mga pagkaon, sa mga tambal?
Wala, ma'am.
So, kanang kuan, ma'am, napa kay allergy sa mga latex na mga gloves or kan sa mga gauze?
Wala po, ma'am.
So, wala kay naibawan, ma'am, sa paghinumdum, mga allergy sa mga gamit sa hospital sa kanang maglimpyo og samad?
Wala po.
Nagapangutana ko ani, ma'am, kay tunggod, unya manggod, di ba, mag-ilis na sa dressing or tabon si mo samad. Kay kung naa kay allergy, pwede na to mano, tapos ignan na to si doc para mabuhatan na to pamaagi.
Sige, ma'am.
Number 1 is to identify expected outcomes. This allows you as healthcare provider to anticipate for the possible outcomes after the execution of the procedure or after the delivery of care. Number 2, administer analgesic as needed or if necessary, depending on the patient's pain tolerance. So, analgesics works by alleviating the patient's feeling of pain during the wound care to promote and provide comfort to the patient during the delivery of care.
So kani ma'am, na ako'y dalang atambal ma'am, i-order ni siya ni Doc. Ang tawag ani kay analgesic. Kaning analgesic or kaning tambal na akong dala, ako ani siya ang ihatag si Muha 30 minutos or 30 minutes bago ta mag-ilis ani imuhang dressing or kaning tabos mo samad. Kani ang purpose ani nga tambal kay unya ini mag-ilis ta og kaning dressing or tabos mo samad medyo sakit man gud jud na siya ma'am. So kaning tambal kay para medyo dili sakit unya pag-ilis nato sa imuhang dressing.
Salamat kay ma'am.
Number 3 is to educate patient as well as patient's family about the procedure that will be done. This act increases patients' feeling of involvement to the planned care for them. Aside from that, it also elicits cooperation and establishes rapport.
So, ma'am, ang atong buhaton karon since nag-order man si Doc o to do wound dressing, pasabot anak ma'am sa to do wound dressing, ato ang ilisan ang imuhang daan nga dressing. Kani siya kanitabo sa samad. Ato ani siyang tanggalon niya. Pagtanggal na tuon niya sa daan nga dressing, kani sa daan na tabon, kay ato siyang i-irrigate. Pasabot, irrigate, kay ato ang paagasan og solusyon. Para asa man ang solusyon? Kay para mga tanggal tong mga exudates or mga nana para malimpyo ang imuhang samal. So pag malimpyuhan imong samal og tarong, ilisan nato siya og bago na dressing, bago nga tabol para gwapo ang iyahang pag-heal or kanang gwapo ang iyahang pag-ayo sa samad ba. Ma'am ha?
Sige ma'am. Salamat.
Number 4 is to prepare and gather appropriate equipment and materials needed for the procedure. This act allows you as a healthcare provider to maximize your time, your energy, and your effort during the delivery of care. Aside from that, it also reflects you being an effective healthcare provider.
Prepare appropriate equipment needed for the procedure. So here we have a normal saline solution. The type of solution that will be used during the wound dressing will depend upon the doctor's order. So for my patient, the doctor ordered a normal saline solution that will be used later during the irrigation or the cleansing of the pus or exudates. So next, we have here kidney basin. So if you don't have kidney basin, you can make use of a disposable Tupperware like this. That will serve as the receiver of the waste solution during the irrigation or the cleansing. Next, we have here a syringe, bandage scissor, bandage tape, a cotton buds that we'll use for the specimen collection depending upon the doctor's order for laboratory. Next is a waterproof underpads. If you don't have a waterproof underpads, you can make use of any cloth or any towel that will serve as the protector of the patient's bed for spillage. So, if anticipated of splashing of wood, a set of personal protective equipment should be prepared. So, here it is. Disposable gloves, face shield, a trash bin, or if in the hospital setting, you can see a yellow trash bin that meaning a hazardous bin, an apron to protect ourselves as healthcare professionals during the wound dressing, and of course, alcohol for hand hygiene.
Number 5 is to provide patients privacy to preserve patient's dignity. It can be done by closing the patient's door, closing their curtains, and also only exposing the area which is intended for the procedure. Also do hand hygiene to deter or to stop the spread of microorganisms, not just to protect the patient but also to protect yourself as the healthcare provider. Lastly is to position the patient appropriately to promote and provide patient comfort. Number 1 is to do hand hygiene to deter or to stop the spread of microorganisms, not just to protect the patient but also to protect yourself as the healthcare provider.
Hello, ma'am. Bakit anak ko nga alcohol touch? Hello, ma'am. May buntag. Magsugod na ta, ma'am, ha? Mag-wound dressing na ta. Ilisa na to na yung dressing.
Number 2 is to form a cuff using the biohazard bag and placing it near the patient in order to avoid spillage during the irrigation, and also to throw the trashes nearby to avoid cross-contamination around and to promote patient safety as well. Number 3 is to apply PPE or personal protective equipment appropriately, especially if spillage is anticipated or expected. So it is done not only to protect the patient but also to protect yourself as the healthcare provider. Also do hand hygiene to, of course, deter or to stop the spread of microorganisms, to promote comfort and safety. Number 4 is to wear clean gloves and assess patient's wound. So in assessing patient's wound, we can make use or to be guided with the following mnemonics. COCA, so C stands for color, O for odor, C for consistency, and A for amount of drainage. So using this mnemonics for assessing patient's wound will help us to assess and evaluate the current status of the patient's open wound. Number 5 is to only expose the area intended for the assessment or intended for the procedure. This act allows you to preserve patient's dignity and provide patient's privacy. Number 6 is to irrigate the wound using a wide opening. Fill the syringe using the irrigation solution that was ordered by the patient's physician. So there are a lot of irrigation solution. It could be normal saline, lactated ringers, or antibiotic solution, depending on the patient's physician's order. Number 7 is to attach a 19-gauge angio catheter to the syringe. It will allow you to provide approximately around 15 psi of pressure to the wound during the irrigation. Number 8 is to hold the syringe above the wound site. It will allow you to cleanse and irrigate the wound following the less contaminated to the most contaminated area to avoid the cross-contamination and the spreading of microorganisms. Number 9 is to continuously flush the wound site or continuously irrigate the wound site until it appears clear. It allows you to remove the exudates or other toxic that is present in the wound site to promote a good healing. Number 9 is to irrigate the wounds with small openings. So it is done by attaching a soft catheter to the filled syringe to facilitate the entry to the small area or small openings for cleansing or irrigation to flush the exudates or other unnecessary materials to promote healthy healing. Next is to insert the tip of the catheter into the openings, so it allows you to avoid the splashing of the irrigation solution by using a slow, continuous pressure during irrigation. Next is to pinch off the catheter below the syringe while in place to promote security during the irrigation. Next is to remove the syringe and then refill it with the solution. Then attach it with the catheter, ensuring that the irrigation solution is clear to make sure that the wound site is clean and to promote good healing. Next is to apply clean gloves and then cleanse the wound using a handheld shower. Next is to do hand hygiene and apply clean gloves. So during the irrigation using a handheld shower, ensure that the patient is seated comfortably and make sure as well that the water is warm enough to avoid discomfort during the irrigation. Aside from that, ensure also that you are following the technique of irrigating from the less contaminated to the most contaminated to avoid contamination. Next is to shower the wound around 5 to 10 minutes. This gives you enough time to cleanse or irrigate the wound to ensure that you remove the exudates or the pus or other unnecessary materials that is present in the wound to promote good healing. Next is to obtain cultures after cleansing using non-bacteriostatic solution if indicated. It is done if the doctor ordered for laboratory purposes. Ma'am, magkuha tag specimen, ma'am. Next is to dry the patient's wound edges using a gauze and then dry patient to avoid patient skin irritation and promote comfort, of course. Ma'am, ato ang i-dry ang palibot si muhang samad. Next is to apply appropriate dressing, then label it with the date and time and the initials of the healthcare provider who did the wound care. It will help you and your co-nurses to identify and evaluate the due time for the next wound care for the patient's wound. Ma'am, ato anong tabunan imo samad, ma'am, para di na siya mag-contaminate. Palihog ko gunit, ma'am. Dari, ma'am. Oh, dala. Next is to remove your gown, your goggles, and your mask in order to deter or to stop the spread of microorganisms and to prevent future contamination. Next is to dispose equipment, also dispose soil supplies, removes gloves, and do hand hygiene. It is done to avoid the cross-contamination of the microorganisms that could cause further complications to the safety of the patient as well as the safety of the healthcare providers. Number 1 is to assess patient's level of comfort. This allows you to assess patient's comfort after the procedure or after the wound care. Aside from that, it also allows you to further assess patient's needs. Number 2 is to monitor the tissue that is found in the patient's wound bed, as it allows you to assess and evaluate the current status of the wound of the patient. Fun fact, if epithelial tissue is found in the patient's wound bed, it signifies or it reflects or represents healing. Number 3, assess the patient's dressing once every shift or as needed or as ordered by the physician, as it allows you to assess the patient's wound drainage or the need for wound care. Number 4 is to evaluate the peri-wound skin integrity because the continuous application of the adhesives may affect the integrity of the surroundings of the wound. Number 5 is to observe the presence of retained irrigants to avoid the skin irritation of the patient. Number 1 is to record all the procedure that was done to the patient as well as all the findings that was gathered during the procedure in the patient's chart, as it allows you and all the healthcare provider that handles the patient, especially the physicians, to monitor and track the status of the patient. Lastly is to immediately report to the attending physician if there are noted unusualities. Examples, if the pain scale of the patient increases, if there are evidence of fresh bleeding, if there are found retained irrigants, and or there are signs of shock. So report it immediately to the attending physician in order for the physician to order a set of intervention to intervene the noted unusualities for the safety of the patient.